Sorry. So basically, as a family physician and counselor, my base outlook is to look at health as a whole, not just in parts, not looking only at the body, but the mind, body, soul, and spirit. And this concept is something that I've heard from many years after I did my MBBS. Now I have got an opportunity to have learned it from CMC Vellore when I did my postgraduate diploma in family medicine, as well as from the mental health course. So out of that came out the initiative called Raahat. It's a whole person care wellness center which we have started, and we are looking at advocating holistic approach to health, bringing about awareness in people. Because mostly when people look at health, they just go for the physical symptoms. They only look at or concentrate on what is physically happening to them. They don't even think about how the emotions, how the mind has a big role on the body. And that is one thing that I'm looking at, bringing about awareness, bringing about a change in attitude in people. And that's why I keep and my me and my team, we keep arranging small seminars for this online right now. And we're looking at emphasizing on preventive care, lifestyle changes, and personalized help to the person. So it cannot be one size fits all. It has to be a holistic, individualized approach, so that people can lead fulfilled lives, healthier lives. So today we have with us Dr. Nishtha Dalwani, who's also part of our team. She's a psychiatrist and psychotherapist. She has 22 years of experience. She's passed out from KEM Hospital, and she currently serves as a fellow in the Indian Psychiatric Society, and also she's an executive committee member of the Bombay Psychiatric Association. So it's really great to have her, and she agreed to come and share um, what she has experienced in her practice, in the 22 years of practice. She does a lot of other things, so she will share a lot about what she does and how she manages patients. So today's topic, like you all have all registered for, is about understanding schizophrenia and psychotic disorders. So how we can do that is through different patient stories. So we're looking at 4 different patient stories today, and we will like go into the whole aspect of schizophrenia and psychotic disorders. So that's what we are planning to do. So I just want to welcome Dr. Nishtha. Thank you so much, Dr. Nishtha, for being here. And I want to thank each one of you all for making the time to be here too. I'm sure this session is going to be, throw some light and break the silence towards psychotic disorders and how it affects the person and how it affects the families, and what we as maybe we are healthcare providers, some of us are healthcare providers, some of us may have family members who have gone through this condition, and you all want to know more about how to help the person. So we hope those questions or queries will be answered during the session. Okay, so Dr. Nishtha, so Dr. Nishtha has shared a few, case. So today I'm going to purposefully not use the word case studies because they are not cases. They are human beings, and we want to say patient stories. Okay, so we are looking at 4 different patient stories, and I'll be asking. She has shared these stories with me already. Um, So we'll be having a recording of this. So we will pass it on to you all later. So don't worry about taking notes. So you can listen to it later. We'll try to upload it on YouTube also. Some of you all are asking for that. So I'm going to ask Dr. Nishtha some things regarding pertaining to this cases. At the end of the session, we'll also have, so if you all have questions, you all can either put it right away in the chat box, or you can put it at the end. So we'll take questions at the end. So that will help us in the flow of the whole, session. So, Dr. Nishtha, the first patient story that you had shared with me was about this young adult student, 21-year-old. She was diagnosed with schizophrenia at the age of 18. And while she was preparing for her NEET entrance, her family noticed that she started muttering to herself, smiling without reason. And suddenly she went missing from school, and then they found her in the police station, in one of the metro cities in India. So, can you just I'll just ask you, what exactly do you feel is the importance of early intervention in schizophrenia, especially in cases of young adults or adolescents? So, what do you feel is important as a psychiatrist?
Good afternoon, everyone, and thank you, Dr. Vinita, for having me on this session. Good afternoon, everyone, and thanks for joining in. These are real case examples of my patients. The first case now, which I have given Dr. Vinita. So, in this case, the point I want to bring up is the prodrome symptoms of schizophrenia. So, this patient of mine had symptoms 3 years back, and the earlier symptoms, which Dr. Vinita just mentioned, what the mother noticed while she was preparing for a NEET exam, she would just be smiling to herself, and she couldn't remember her studies. She would forget whatever she had studied. She could not concentrate. So the mother did not doubt anything, and she just ignored it. And it went on and on till one day she was found missing from school, and then she was complaint was registered, and she was found in the police station. So these are the prodrome symptoms which I want to pick up here, and if they are, picked up early by the lay people, the families, the illness can be nipped in the bud, before it goes on to develop a full-fledged psychosis. Because treatment in the prodrome, that is these early symptoms, which we very often they just have only anxiety or just very some change in cognition, some isolated behavior, some social behavior which is unacceptable. So if we pick it up that time, the dosage of medicines which we need to give the patient is less. And also we can treat them very fast before they go into a full-fledged psychosis. So for that, the whole idea is to raise the awareness about treating it early and nipping it in the bud. So I put this case up. So 3 years, it took 3 years for the family to, actually get her to treatment. Though it was a very educated family, parents were working, but we are not still aware about the earlier stages of the illness.
Yes, thank you. So, what do you think are some of the practical steps that families can take to support the treatment and the progress in the young patients with psychosis?
So in this case, as I said, she was not able to do her exams. She was, there was academic decline, and she was a very bright child academically. She had scored very good percentages in her 10th standard and in her 12th, and she was preparing for the NEET. So had this been treated 3 years back, we could have had the family known these initial symptoms that and seen her, taken her to a doctor and got it treated, maybe, we could have helped her much earlier, because the patient suffered full-fledged psychosis. She's had hallucinations, she was hearing voices, and she became violent, she became aggressive, and at that stage, she was brought to the casualty. And we psychiatrists saw. So most of the cases that I see in my clinic is mostly when they become really extreme, is that's when they come to us. So the idea is to bring them early, and the family can help in this way by picking up the signs earlier. So the teachers, the counselors, the general practitioners, the local doctors, and the family, if they're educated and they know the symptoms, so they can get early treatment done. So it doesn't, if you treat early, it will not go to such a bad shape. So that we can improve the prognosis that way
Right.
and integrate the patient back into the family and the society.
Yes, thank you. Thank you so much. So, we see that you keep stressing on the importance that the relatives or the family members pray. So can you tell me, how does it's difficult to empathize towards such patients, because sometimes they're violent, they're not, they're maybe probably disobedient. So the family may think they're just acting up, or maybe the teenage hormones are playing up. So how do they balance empathy and ensure that the safety, of the person is taken care of? How are they? How can they be safe, especially in cases where they are like just suddenly wandering, there is suspicious behavior?
Tough. It's very difficult for the relatives. I mean, it's easier for us to give a lot of advice, but living with a patient who has schizophrenia, it's a very, very tough path. We do family counseling, and I think having a very good caretaker goes a long way in handling these patients. Because since they are psychotic, empathy doesn't come very naturally because we can't forgive the episodes, the hallucinations and how they abuse and they hit and all. So we don't, these patients themselves don't have insight into the illness. They themselves are not aware that they have the illness. So we have to understand that. And I remember in this case, when she was brought to Bombay, um, just 1 minute.
Dr. Nishtha, you're on mute.
In this case, when she was brought to me, she had come to a maternal house in Bombay, a granny's house. And that was when she was brought to me after 3 years of the illness. She was 21. And I remember her aunt bringing her and telling me, the mother said that the aunts keep on saying, अरे ये तो पागल है, ये तो कभी ठीक ही नहीं हो पाएगी, ये तो ऐसी रहेगी, आप उसको कितने भी डॉक्टर्स के पास लेके जाओ. So these were the expressed emotions from the own maternal aunts. So this is something patients with schizophrenia go through a lot of this expressed emotions, and this is a cause where following the psychosis our patients develop depression and anxiety, because when they realize what they have done in the psychotic episode, which they themselves are not aware, and the relatives bring it back that this is how you misbehaved and this is what you did, they go into post psychotic depression. And I've had cases wherein patients have even gone to harm themselves because they are not aware. See, it's an illness wherein the patient doesn't do it intentionally. A depressed person knows he or she is depressed, but a psychotic patient does not know that he or she is hallucinating or is, having delusions or is not normal. So that when they get insight and the family tells them, the post-psychotic depression is also an entity, and this comes in also because of lot of expressed emotions from extended family. Because still it's considered psychiatrist pagal ka doctor hai, or uske paas we should not go to a psychiatrist. And the relative, they are, even when we see someone on the road, who's muttering to self, we just ignore and we don't sort of, we think they are, mad. So that's the, and these expressed emotions affect the patient because these patients also are normal human beings like all of us, and they need empathy, they need love, they need care and attention. It's only when someone in your family has the problem you understand, but when it's an outsider, we need to empathize. So it's not that
Yes,
counseling and psychosocial therapy also goes a long way in treating schizophrenics. We just should not just limit to medication.
yes, yes,
Family counseling plays a very, very important role. As schizophrenia, we all know, is a long-term illness. I call all the family members and I, talk to them and empathize and give them the support. Even they need support. I have a lot of parents of schizophrenics who go through depression, siblings who go through depression. So we treat them also because it's a long-term illness. So there's a lot of
yes,
emotional burden on the family members as well.
yes, yes. Thank you. Thank you so much for sharing that. Now we'll go to the next patient story. That is a 26-year-old beautician. She was suddenly feeling suspicious, and she had the suspicion that somebody is physically assaulting her. She was scared. She was violent and aggressive to her parents, towards her family. There was irregular, I mean, the talking was not relevant. Whatever she was saying was irrelevant. And I think she came to you after around 3, 4 years of trying out alternative medications, right? If I remember that correctly. And and then you started treating her. So like how did you manage it, because she came after a long gap. She didn't come in the initial stages, like you had mentioned in the last story. There was a prodromal, the initial symptoms, but you missed out on that. So what I want to ask you is, like, what are the symptoms, like, like, this seems like the treatment was delayed for a long time. So can you
Yeah.
describe what are the symptoms that a person can focus on?
So the symptoms of schizophrenia are of two types from the medical aspect. aspect. So we psychiatrists, there are positive symptoms of schizophrenia and there are negative symptoms of schizophrenia. So positive symptoms are something which we all notice. So they'll be actively hallucinating, hearing voices, smell, different sensations. There is hallucination, hearing voices of people telling them to do things, commenting on their action. These are the active hallucinations. Then there are delusions. Delusions are false beliefs. Like in this beautician, the belief was that somebody has raped her. And in spite of the family saying nothing of that sort has happened, but she was convinced that it has happened. So that was a delusion she had. So that was a second active positive symptom. The third symptom is withdrawn behavior. They will just isolate themselves from everyone. The next symptom we see is aggressive, assaultive. So if they are told to do something, or if they are even suspicious of their own family members. So if you give them food, some schizophrenics feel the food is poisoned and you're trying to kill them when they are in the active psychotic stage. So these all are the positive symptoms of schizophrenia. We also have negative symptoms in schizophrenia, which sometimes are missed as depression, but they are the negative symptoms. So in that, the patient will not take care of self, will withdraw from everyone, will have no motivation to do things, and will also, there'll be apathy, there'll be negative talk, and won't eat, won't take a bath for many days, won't cut their nails, want to take care of self, and just isolate and stay in bed whole day, not do their routine activities or even go to work. So these are the negative symptoms of schizophrenia. And then when you talk out to them, we come to know that there is some psychotic disorganized thinking. So when we actually go and talk to them, you come to know about this. So these cases also are missed, because we feel it's depression, and then the relatives don't understand. Very often, even schizophrenia patients don't talk much to the relatives. So the diagnosis gets missed because they don't communicate. Like the child will not tell the parents what is going on in the mind. So the parents don't know what is happening, and they just think, oh, she's acting out or she's just depressed. So the prodrome symptoms are isolated behavior, anxiety, just
Sorry, yeah.
those are the, yeah. So in this case, she had been to a homeopath doctor. She went for at least 1 year. She was taking homeopathic treatment, and after that, they also went to faith healers. And in the end, after 3 years of the illness, they approached a psychiatrist. And that time, she had full-fledged psychosis. Like she was violent. She was not allowing anyone to come close. So we had to admit her. We had to give her, antipsychotics in injectable manner because she was violent. So the delay was there in the treatment. 3 years of her life, this girl lost. Had we picked it up earlier, 3 years back, we could have given her fruitful 3 years of her life, wherein she lost her job. She was working in a beauty shop as she lost the job because of all this. Her engagement broke. She was engaged, and the engagement broke because of this weird behavior. So had all this been picked up early and not going to faith healers, we could have, treated it there and there itself. And the 3 years we could have given good fruitful years to these patients. Because when she came and I had to admit her, like she was that bad. So had it been picked up earlier by the family, though they were educated, but they were not aware about the mental illness.
Yes. Yes. Thank you. That is very informative. Like I feel like there is a lot of misconceptions about treatment. I think this is my view. Maybe some of the audience may not agree with me, but I feel people have a lot of negative, you know, view about psychiatric medications. Especially the antipsychotic medications when people need to be taking it. So can you tell us a bit about these medications? Like, they say, oh, it causes a lot of drowsiness, the person is going to be sleepy, they're like zombies, so those kind of comments we hear. So can you just touch upon that? And now we know how important it is for the person to be on the medication, but can you just tell us something about the treatment and how you manage it?
So before we go on to that, we need to understand why schizophrenia happens. So
Yes.
schizophrenia happens because we all know there are millions and trillions of nerve cells in our brain. And these nerve cells secrete certain chemicals, which are called as neurotransmitters. And they are, all must have heard about dopamine, serotonin, epinephrine or epinephrine. These are neurotransmitters. And these are the chemicals in the brain which regulate our thought, emotion, and behavior. So just like in the blood, when the sugars go high, your physician tells you, man, you got diabetes, you got to take tablets, so your sugars go down. Your BP shoots up, and the physician tells you got to take tablets and lower the BP. Similarly, the dopamine is one chemical in the brain which is secreted by the nerve cells. And when the levels of dopamine goes high due to various causes, of course, there are genetic, environmental causes of it. And when the dopamine levels go high, that is when these active psychotic symptoms come up. So the medicines, our medicines act by lowering the dopamine in the brain. And they also act on the other chemicals, which are serotonin. There are many different such chemicals. I don't want to get into the details of that. So this is how the drugs we give, they are not just sleeping pills. Yeah, the sleep is one side effect, but now we have so many drugs which don't even, we have to select the drug depending on the patient. So they are not sleeping pills that we are giving. So the misconception that don't go to a psychiatrist, वो दवाई दे देंगे, वो दवाई से सिर्फ आपको सुला देंगे और वो दवाई की आदत पड़ जाएगी, फिर वो दवाई लिवर को अफेक्ट करेगी, वो आपके किडनी को अफेक्ट करेगी, and people stop the treatment midway. I have had many patients, they recover after 1 month, they are fine, they stop the treatment because, oh, your medicines in the long term will affect my liver, will affect my kidney, so I will not take. Relatives stop it, don't go, don't take psychiatric treatment. So this is what happens. But we all know schizophrenia is a long illness. It's a long-term illness. So these patients, depending on the duration of the illness, we have to give medicines for that much time. And we all know that because our medicines don't act like if you have fever, you just take a Crocin or a paracetamol tablet and the fever goes away and wow, you're fine. You have headache, you take a Crocin and half an hour you're fine. Our medicines don't work like that. Our medicines take 2 to 3 weeks to have the effect because they have to cross the blood-brain barrier. And to increase the dopamine, it takes time. So the initial symptoms we see is patient calms down, but the positive symptoms of hallucination, delusions, that comes up, the help comes up in the third or fourth week. So that's why our medicines take 3 to 4 weeks to have the full effect. So this is what we all should know, and we should not stop the treatment midway. So long-term follow-up, and for this the relative role comes in because schizophrenics don't have insight into their illness. So the relative has to have regular follow-up because yes, our medicines do have side effect. No pill is without side effect. So yeah, there are some side effects which we inform the relatives when we are starting. But if the wrong dosages are given, if sudden stoppage is done, very often relatives give the medicine for, some time and then they suddenly stop it. So we should not suddenly stop our medicines. The medicines have to be gradually tapered and stopped. So I tell them on the first visit itself that these are the medicines, how they act, it takes time to act, and then you have to gradually taper and stop the medicine. So all this counseling has to be done. And because it's a long-term illness, also patients get tired taking the medicines and they are fed up and after some time they stop the medicine. And when they stop the medicine, we see 2-3 महीने के बाद फिर से he comes to the clinic with a relapse. So just like blood
Yes.
pressure, just like diabetes, we don't ask our physician, no, iska side effect hai. We take it religiously. We have faith in the doctor. So similarly, it's a very difficult illness. It's an illness wherein lot of care by the caregiver, lot of regular follow-ups and long-term treatment is needed, and medicine along with psychosocial rehabilitation, not just medication. So both are
Yes.
required. So our drugs are all tried and tested drugs. So we don't give just sleeping pills and knock the patient off.
Thank you. Yeah. Thank you so much. That is important. Another thing that happens especially when there are young girls or young ladies who are of marriageable age, when they get diagnosed with schizophrenia, it becomes very difficult for the family because the family wants them to settle down, they want them to marry. So, what is your advice regarding like such kind of patients or people who are suffering? uh, how do you help them, to take that decision about getting into a marriage relationship, it's a lifelong commitment. So how do you advise them?
So, like in this girl, the minute she was diagnosed with schizophrenia, her engagement broke, she lost her job. And now she's very well maintained. Now she regularly, and we have reduced. Now she just takes one tablet in the night. She's in the maintenance dose, and she's now fit and fine. She's doing freelancing. She's doing all her work. She's earning for herself. She's having a good life now. So the mothers looking now for a boy for her. So this was a question she put to me. Now, according to the law, when you get a girl married, and if she has schizophrenia, and it's a long history of almost 4 5 years she's suffering, you have to inform the would-be husband and the family members, because if you get the girl married off without informing them, it's against the law, because it's a long-term illness. So the family in which she's going to go to has to be counseled about regular follow-up with the doctor, about continuing the medication. So we cannot hide and get the hide the mental state of the patient, because when they are fine, they are totally fine. So it's not they so out of those 365 days in a year, he or she may have the episode only for say a month, but the remaining 11 months they live a normal life. So I've had schizophrenics who are maintaining their jobs. One of my colleagues' mother is a schizophrenic, and for the last 30 years she's been working, and she's having a job. She takes some medicine regularly, and she's doing very well. She's raised up children, and done all her household duties plus her job. So just having schizophrenia doesn't mean you can't live a normal life.
Thank you. Thank you. That's very encouraging. Yeah. So the next patient
Ask a
story.
question here.
No, can you keep your questions till the end?
Okay,
Yeah,
thanks.
you can put it in the chat box. We'll take
Sure,
it in the
sure,
end.
sure.
Yeah, thank you so much. The next, the patient story that you have shared with me is about this 40-year-old person who's an IT professional. And he started hearing voices of unknown people telling him to kill himself. But there were no other psychotic or depressive symptoms. And he had some amount of anxiety and this the only auditory hallucination. So, can you tell us how, it doesn't look like the other two cases, the stories where they had a full blown episodes of, being angry, upset, and those kind of things. He was only hearing voices. So, how do you differentiate between this and what is this called? How do you define this?
So this is a condition we call as brief reactive psychosis. Now, this person came to me. He was an educated IT engineer, and just one symptom. He was hearing voices telling him to kill himself. That's all. And that voices caused a lot of anxiety in him, because he didn't know there were no other psychotic symptoms. There were no other depression or anxiety symptoms, just these voices. And I just started him on low dose antipsychotics, and he was okay. In 10 or 15 days, the patient recovered, and I continued the treatment for 1 month. And he took off from work for that much period, and then he was back to normal. So the point I want to bring, the reason I brought up this case is to tell the audience is that not all psychosis is schizophrenia. So it's not necessary anybody you see who's having a psychotic episode is a diagnosis of schizophrenia. Now, this was just a brief reactive psychosis, and now that person is totally fine. He just took 1 month of my treatment, and now he's back to his work. He's having a normal life. So it was not schizophrenia. It was just a brief reactive psychosis, for which now this could also happen sometimes with drugs. Youngsters do abuse cannabis, they abuse other drugs, and they can also cause a temporary psychosis. And we mistake it, oh, it's schizophrenia. No, it's a temporary psychosis. Alcohol in the long run, long term alcohol use in late age causes psychosis. But they all are brief periods. And in these brief periods, if you just give short term medicine and treat the patient, the psychosis goes away. So, not all psychosis goes on to develop schizophrenia.
Yeah. So, do you have a particular diagnostic criteria for this? How do you
So, we
differentiate between it?
So we psychiatrists have these two diagnostic criteria. One is the DSM-5, that's a diagnostic and statistic manual for psychiatrists, five, out of which there are some five. I already mentioned the positive symptoms to you all. So two of those symptoms should be present. So active hallucination, active delusions, social deterioration, lack of hygiene, irrelevant talking, muttering to self. All these have to be present for consistently for 1 month, and not
Okay.
responding to, any, and it's worsening and causing socio-occupational deterioration. So we have these criteria by which we say, okay, now you have this diagnosis. Still, And the other criteria is the ICD-10, ICD-11 now we have. So that also we have certain symptoms, because mental illness, we have to put these categories to, differentiate. Otherwise, it's difficult to, diagnose these people. So DSM-5 and ICD-10 are the two ways we diagnose. We have a list of the symptoms, and if patient has those symptoms, but they have to be for a substantial period of time to label somebody with the diagnosis as far as possible, not to label someone with a diagnosis straight away.
Right. Yeah. Thank you. So, is there anything in particular that a person who has had this episode has to do, or there needs to be some sensitization in the workplace? Like, suppose now somebody has an episode in the workplace, and then when he gets back to work, probably he's being labeled as something. So, is there anything that you uh, can recommend for?
Nowadays we have counselors in the big companies. Like this gentleman was from a big IT company where he was working. They have counselors in the company. Plus, we also the company gives them the awareness is much there in these big companies, so they give them off also from work. And yeah, the colleagues who have observed that episode in the office, for them, I think they need to understand and reintegrate him back into his job, and not have expressed emotions by, oh, that he's mad or he behaved like this. So forgive and forget, because it's an illness like any other illness. So the staff, but nowadays people are more educated, and they get a fitness certificate from the psychiatrist, and if they are certified fit to resume work, and nobody interferes. People understand the stress induced psychosis also. So people understand all that. So I think that is a good thing we see nowadays. There are many counselors now. Most schools have counselors. Most big companies have got a counselor in the company itself.
Right. Yeah. So, Uh, the fourth patient study, which you had also shared with me, is about this person who was having, I think, a 46-year-old patient. Uh, just a
Mhm.
minute. And she suddenly started having irrelevant talks, paranoid ideas about the in-laws. She was not sleeping. She had increased appetite and a lack of personal hygiene and confusion. So, how did you manage this kind of a person? Hey, you're on mute, Dr. Nishtha. Sorry. You're on mute. You can, yeah.
Uh, yeah, in this case, I brought up this case mainly to understand the difference between what is called as organic psychosis and a functional psychosis. So sometimes the cause for psychosis can be just muted 1 minute. I have
Sorry about that. Yeah. You're on mute. Yeah.
Sorry about this. Yeah, so in this question, I brought up this case just to understand the difference between the organic and functional psychosis. So organic psychosis, like this person, whom in this case she had hypertension, she had diabetes. So we admitted her, we got her blood test done, and we found that the sodium levels were low, due to which the psychosis was happening. So sometimes even when the blood parameters fluctuate, like less or more of sodium, potassium, or there are other causes, in the brain, organic causes also. Like, so if there's a brain tumor, or if there is some infection in the brain, or any other organic cause can also trigger a psychosis. So this was the case I brought up for that reason, that all cases of psychosis need not be schizophrenia. Sometimes we have a medical cause for it. And we corrected the sodium of this patient by giving her by the physician gave her the sodium externally, and after that the psychosis settled. So ruling out organic causes of the psychosis also is important. So you get a CT scan, MRI done, you get the blood test done. So especially in an elderly where you're suspecting that, the she already has hypertension, diabetes, and the psychosis has come, short-term psychosis.
Okay. Yeah, yeah. So I think what you're trying to say is that you first rule out if there's an organic condition which can be treated medically, and then suspect if if it's related purely to the mind or the neurotransmitters. So that should be the way a person is diagnosed and then completely, labeled or given a diagnosis of schizophrenia, right? So that's what you're trying to say. Yeah. Thank you. Yeah, that's helpful. So I think one thing that I wanted to ask is, like we see now people, especially in India, we tend to, our first focus to be going to faith healers. So how would how would we try to bring about awareness? Can you share some examples of cases or stories which have just gone haywire and they come to you in quite a dire situation by the end of it? So can you just describe or just share something?
Yeah. So there have been one case, person that person was hearing voices, and they went to faith healers, and the faith healer said wo kaan mein problem hai, put rods in the ear. She was a young girl, so steel rods were put and they burst the eardrum and she developed deafness in that ear. So the relatives were from Bihar and they were not aware about, what to do, because she was behaving, talking irrelevant, saying she's hearing voices. So they just took her to the faith healer and he put rod saying that uske kaan mein problem hai, wo ye rod dalne se theek ho jayega. So her eardrum ruptured and she was seen by an ENT and treatment was done. So things are to that extreme because awareness is not there. So we have to break this stigma and we have to raise the awareness. Even I have youngsters who bring their parents to me, but the parents are not willing to come. So the current generation is very, very psychologically minded, I see. Our teenagers, our youngsters are very psychologically minded. But when it comes to the elders, they are still not, because for them that concept is still not there of mental. So we have to break the stigma. We have to make people understand that treatment is there, help is available, come early, take treatment, and get the relative cured of the illness.
Thank you.
Don't take them to faith healers. So, they do Ayurvedic, they will do homeopathic, they will go to those wellness centers. I've had people spend lakhs of rupees in these wellness centers. And how I had one patient who was misguided, and he spent so much of money till he realized that it's a psychiatric problem. And finally, after years, he landed up with a psychiatrist and got treated. So the awareness is the, main thing. We need to increase the awareness.
Yes, yes.
And
Thank
that
you.
help is available, treatment is available.
Yes, yes. So, what do you think, is a role of, a psychotherapist? Now, this is you are a psychiatrist, and you're, um, so what is the role of a psychotherapist in this, this particular scenario? How do you think that will help the person who's diagnosed with schizophrenia? I think your camera is on.
Switch that off. Hello. Yeah, sorry about that. Yeah, so along with medication, the other thing is psychosocial rehabilitation. Psychosocial rehabilitation is the thing we all say what counseling doesn't help for schizophrenics. No, counseling goes a long way in rehabilitating family support, reintegration into the society, reintegration into the community, having them live a normal life, normal marriage. I've had a lot of schizophrenia females who come and tell me, even I want to get married, I want to have children, I want to have a normal life like everyone. And of course, they have a right to have a normal life. It's for the family, doctors, the general practitioners, the local doctors. The local doctors should refer them only to the psychiatrist. and the counseling team. So like now we at Raahat have a full team. So the team can, help the patient, treat the patient, and then reintegrate them back into the society. So psychosocial intervention techniques are various psychotherapy techniques. Like we do cognitive behavior therapy, we do family counseling, we do, counseling at how to cope with your academics, how to cope with your professional life, interpersonal counseling. So all this goes a long way in rehabilitating the patient.
Okay, okay. Thank you so much. Thank you for sharing that. That's helpful. Another thing is about rehabilitation. You mentioned rehabilitation. So can you just, share some, success stories of how, rehabilitation has helped a person who's been on medication and completed the counseling and now they have been rehabilitated and integrated back into the normal society.
So now in all over India, we have rehab centers, rehabilitation centers. We have daycare centers as well, wherein, handling and treating, being with the patient 24/7 is also very draining for the relatives. So we have daycare centers wherein in the morning the relatives can drop the patient there. And in the whole day, there are occupational therapists, there are all activities like yoga, creative activities. So I'll just show you, I just brought this on the session. This umbrella has been made by a schizophrenic patient. And when we had our annual Bombay psychiatric meeting, and where all some 400 psychiatrists of Bombay attended, this was the gift we gave each one of them, all the psychiatrists, to take home when they registered for the conference. So, what I'm saying, these people are just normal like you and me. So, we all have to rehabilitate them. So, giving them certain activities based on their IQ and the level of the damage in the brain due to the illness, we can reintegrate them and give them, maybe say if you have someone who's in a high profile job before the schizophrenia has come, putting them in a low profile job, but I'm sure they can be in a job. So we can, there are patients who have been engineers, there are patients who have been chartered accountants, they've been lawyers and developed that. So many doctors have had schizophrenia. So nobody, the illness doesn't select the person, right? Anybody can get it. But we can reintegrate them so they can have a low profile job, they can take time off in between when they have the episodes. So we have daycare centers and we also have full term rehab centers. And in these rehab centers, along with medication, along with treating the patient as a whole, we also have yoga therapy. We have a full day, we have a occupational therapist, and they are doing all creative activities there. They are learning new skills, which so that they can go back. We tap where the talent is, of the patient in extracurricular. So if the patient cannot function academically due to the cognitive deficits, in any extracurricular, they can be good at some sport, they can be good at painting, they can be good at drawing, they can be good at singing. So there are other things where that potential can be tapped in these rehab centers, and we give them a routine. So very important that the person keeps a routine. The illness does not, for any illness, I always tell my depressed, anxious, and a psychotic patients, do not break your routine. So getting up in the morning and just following that routine and doing activity when the mind is idle, and idle mind is a devil's workshop. So you overthink. So even for these people, we have a full day activity. They get up, they go for yoga, they have individual counselors who talk to them on a regular basis. They have regular psychiatrists, they have physicians, they have all the doctors seeing them. So in a rehab center, we have many rehab centers in India. All over India, we have rehab centers for these patients. So relatives keep them in the rehabilitation center for a month, and then once 1 month, 2 months, depending on how bad the patient is. And then we reintegrate. Then there are daycare centers wherein working relatives can keep the patient in a daycare center. So whole day they are in the center and they also occupied. And the relatives can, go to work, and then night they pick up the patient. Plus the patient learns a lot of skills, occupational skills to go and rehabilitate, and, at least on their own expenses, at least they can sustain themselves. That is more important, get their own
Great.
day-to-day routine. I mean, at least they can sustain, they are not a burden on the family.
Yes, yes. Thank you. Thank you. That's very, like, it's very exciting to see that the person can be rehabilitated and get back into normal, integrated into the normal society. One, I think, last question that I had was, what would you see as one of the reasons for schizophrenia? Like, what do you think is the cause or? the reason why a person develops? Is there something that can be prevented, or is it something that's just genetic? What do you think?
So schizophrenia is an illness, just like we have blood pressure, we have diabetes. There are no causes, anybody can get blood pressure. So we see about 10% is the general. So out of 100 people, you will have 8 or 10 people who may have mental illness. So we don't
Hmm.
question it why it has come. Yeah, but it's a combination of gene versus environment. So genetic factors do play a role. Plus the environment, I already explained to you about the neurochemical factor, the excess dopamine causing it, and certain brain changes as well are there. So that also causes just one.
Great, great. Yeah. Thank you so much, Dr. Nishtha. I think we've covered most of the questions. So I'd like to open this up now for uh, the audience to just share if they have anything or they want to. Somebody had already asked for a time to ask questions. I think it was Yamini, right?
Yeah, that's right. I mean, now that you just said that it is related to genetics as well, so I was just wondering, you said that there was a mother who managed her job and her children along with this illness. So is there a genetic predisposition for the children?
Okay.
Yeah. So
Dr.
is it?
Nishtha, you're on mute. Huh? Yeah. Yeah. 1 minute. Huh? Dr. Nishtha is just having some technical issues. 1 minute. Huh? Just give me a minute. Sorry for that interruption. Just give us a minute. Huh? In the meantime, if you all can, if you all can put your questions on the chat box also, those who don't want to unmute, you can start. I think we already have another question by Xavier.
Can I ask question, doctor?
Yes, yes, just a minute. Give us a minute. Huh? Dr. Nishtha is just getting back. Yeah, so Dr. Nishtha, there was a question from Yamini. Yamini, you want to repeat that question?
Yeah. Good evening. Since you mentioned that there is a genetic background to this illness, I just wanted to know whether, you also mentioned that there was a parent, a lady who was managing her family, her job very well with this illness. Is there a genetic predisposition to these mothers and fathers? When you go into a marriage, do you have to go in with keeping that at the back of your mind?
Uh, yeah, thanks for that question, Yamini. Yeah, genetic predisposition is there. So we have done family studies and we have found that if one parent has got schizophrenia, there are chances in the siblings also of developing. But the incidence is, it's not that it is definite. So if she has 2 children that they will develop it. But yeah, the chances are there. If there's a family history, very often we ask that in our history because 10% chances are high that one of the child would get the illness from the mother. But it's just a coincidence. It's just 10%. It's not that it's going to be very high if the one parent has got schizophrenia. So we can see there are, the any illness like we see diabetes runs in family, we see hypertension runs in family, heart diseases run in family. So mental illnesses do run in family. So there's not necessarily schizophrenia. One parent may have depression, one parent or some uncle may have anxiety issues, and we see that the child, the patient also has got. There's a question in the chat box. Hi, I'm a
Yeah.
special
Thank you.
education teacher. I would like to ask chat
Yeah.
box.
1 minute, Dr. Nishtha, I'll read
Yeah,
it out for you.
yeah,
In
yeah.
the meantime, can you just answer Mr. Bajrang who had a question to us?
Yeah.
And then I'll read
Yeah.
out what is there
Can
in the
I
chat
ask?
box. Yes, yes, sir.
Can I?
Yes,
Madam,
yes.
I want to
Yes,
ask
yes.
doctor
Yeah.
that I am suffering from schizophrenia for last 40 years. Only one day and one night I had an episode and 6 days hospitalization. Then continued the medicine, no relapse, nothing else. It is the short-term psychosis or it is still the schizophrenia? I am still continuing the medicine without fail. But just I go to the psychiatrist, they say continue, continue. It is the episode or I am still on schizophrenia?
I would like to go into the history, Mr. Bajrang, since how long, what were your symptoms and how much was the duration of the symptom?
40 before 40 years for one day and one night there was the all system or symptom of the schizophrenia and 6 days hospitalization I was cured. Then was nothing relapse after that, nothing, but only just continuing the medicine. I worked also, I was in service and I have brought my children, 3 children, MBA engineer, chartered accountant, all I made them. But still I am continuing the medicine. It is the short-term psychosis or it is still schizophrenia only?
So I
Uh,
think this would be difficult to judge on this call, sir, because your entire history would be needed. You'll have to adjust the doses and check. So Dr. Nishtha will, I mean, if you are in Mumbai, that's fine. You can come and consult her. But it needs to be under supervision, medical supervision. On this
Mm.
call, it will be difficult to answer that, right?
Mhm.
Yeah.
Right.
because we need a full history from you. We need
History.
the relative. We need a full history because if you're continuing the medicine for 40 years, so there must be much more to the history. So I think a full, either it's an online consultation or coming to the clinic and seeing, because I need to go into the details and it's not possible to do it on the call. Then we can, if everything is okay, we can try tapering the medicine and check.
Yeah.
Mhm.
If there
Yes.
is no relapse of symptoms, we can taper it.
Because I have raised my 3 children, I made them with working, I am servicing in private, and I made them
That's
engineer,
very.
MBA, and all chartered accountant, all singly. My
So
wife is housewife.
you're a perfect example for all the audience that how we can have a normal life in spite of having the problems. So congratulations, and it's very nice to hear this from you that you have raised up your children so well that they are now
Yes.
so highly qualified. So
Well
God
done.
bless you
Yeah.
and your family, and we can connect personally for this.
And my wife is only sixth standard. She is housewife. I have managed her also financially.
Very nice to hear that. Yeah.
Thank you. Thank you for sharing your story. Yeah. There is another question. So the patient is 12 to 13 years with the said mental illness on strong medications and is stable. We notice when the medicines are skipped, even for a day, it impacts him.
Just
The
1 minute.
question,
The chat box.
yes,
Who's
yes, I'm reading that. I'm reading that. Xavier has asked this.
1 minute?
Okay. Yeah, we notice that when medicines are skipped, even for a day, it impacts him. The questions are, since he's still not able to focus, he's not able to work, and secondly, do such patients also get into addictions? So I think
It's
it
in
means
the.
other addictions. You may not get it in your chat box right now, Dr. Nishtha, because you've changed your device.
It's
Yeah,
okay. It's in the other device. Yeah.
yeah.
Okay. So the question is that whether he has to. I didn't follow the question.
So
I'm
the
sorry.
question is, he is on medication. If he skips it, or even for one day, it impacts him greatly. Now he's still not able to focus, and he's
Hmm.
not able to work. And the next question is, does such a patient get into addictions?
Yes, this is a very good question. So since how many years he's on treatment and how old
12
is
to
the
13 years.
how old is the patient?
He is,
Xavier?
yeah,
Huh.
he is close to 35 years now. Yeah.
Okay, right. So the problem here is that we all know that schizophrenia is a long-term illness, and the minute But it has a very wavering pattern. So some patients get episode or relapse once a year, some get it once in 6 months. So I usually ask my patients to keep a chart, keep a chart of your episodes. When did it start? So sometimes we see it peaks up in certain time of the year. So I've had patients who had, they keep a chart of their episodes. So we know when the next relapse is also going to come. So accordingly, we adjust the dosages. So yeah, we can reduce the dose, we can make it less and see. And the other symptoms which he's having, you said he can't concentrate on studies. So we all know that because of the schizophrenia, there's some cognitive decline also happening in the brain. So these people cannot function 100% like all of us. So their functioning also goes down. So their functioning is 50 to 60% based on the severity of the illness. So there are patients who, in spite of, like now we just heard Mr. Bajrang, so he could function, maximum. But it also, every patient is different. So depending on how bad the symptoms are, the frequency, the duration, the intensity of the symptoms is the amount of damage in the brain. So the cognitive decline which happens makes them not able to sustain their jobs, not able to, be their pre-morbid level of functioning. So I think individual assessment would be needed. And obviously the efficiency, you cannot get them back to their pre-morbid personality all the time. So the academic or the professional rehab has to be done based on the current mental state. So if he's functioning 50 to 60% of his normal capacity, the job, the academic studies, whatever he's doing has to be to that level.
Thank you, doctor. Thank you. I think we will get in touch with you. Yeah.
Yes. Okay.
Thank you. There's another question from Nawaz. Will we be getting literature on understanding schizophrenia and the different kinds? So Dr. Nishtha, can you give us some links? Maybe we can forward it to the participants.
Sure, there are different types of schizophrenia. The symptoms also are different. So we have, just to rush through it quickly. We have paranoid schizophrenia. We have disorganized schizophrenia. We have schizoid type personality. So there's a whole spectrum. We can have someone who's just having one symptom and not having the others. So I will give it to Dr. Vinita, and we can put it on the Raahat on the channel.
Yes.
All the literature, so because it will take too much time for me to explain all this. So
Yes,
I'll give Dr. Vinita, and she can put it on the Raahat channel.
Yeah. Thank you. So another question is, why does the dopamine level get disordered in the brain? What are its causes?
Yes. So the causes for this change in dopamine could be one genetic. Second is any environmental stress. Yeah, very often my patients come, though they have schizophrenia, it could be triggered by an external environment. So a loss of job, a divorce, failure in an exam can trigger a psychotic episode. So we all know, nowadays why we find patients doing all so much gaming. Children, what is there? Why they play so much games? Playing too much games also increases dopamine in the brain. Why do we eat so much sweets? When we eat too much sweets, it increases dopamine. So increased dopamine gives us a kick and we feel happy. So all what we think, what we do, it's all modulated by neurotransmitters in the brain, by these neurochemicals in the brain. So why dopamine goes up, why it goes low? In depression, we see the serotonin. Serotonin is another chemical in the brain. In depressed patients, the serotonin is less. And I've had my patients come and ask me, ma'am, why is it that I have depression? Everyone is happy, only I feel depressed, and there's no reason for me to feel depressed. So this is called as chemical depression or endogenous depression, where there is no cause, external cause, perfect environment, perfect job, everything is going fine, still the person is feeling depressed. So that is, and it's like it's just a prevalence of the illness. So out of 100, 10 people will have schizophrenia. Out of 100, 15 people will have depression. So it's just like if you can have BP, if you can have diabetes, similarly you can have. It's a general prevalence of the illness.
Yes, thank you. Thank you so much. The next question is, what kind of people have high chances of schizophrenia? Is it people who are loners and don't have any genuine connections in life? Is it those kind of people who tend
That's
to
a very
get?
good question. Yeah, we have seen people who don't socialize much. The pre-morbid, we psychiatrists call it the pre-morbid. Morbid means when the illness comes, morbidity. So pre-morbid means how they were functioning before the illness actually came, the pre-morbid personality. And in most of my schizophrenic patients, I have seen that the pre-morbid personalities, either they are very paranoid, means generally they are people, बोलते हैं ना शक्की स्वभाव. Anyone is trying to help them also, still the doubt is there. Some of us are like that. We need not be, have a mental illness, but our nature is such, oh, she's helping me, there is some reason she's helping me, she's being sweet to me, or she's manipulating. We have that nature, all of us have nature. So we have found patients who have schizoid personality. Schizoid personality is when they just are very lonely, they don't have social contacts, they enjoy their own space, they are introverts. Then we have, that is a schizoid personality. There is also an entity called schizoid personality disorder as well. And then we have people who are paranoid. So schizoid people and paranoid, shakki people and people who are loners have high chances of developing because there's no social network. And they live in their own world. They are in their own space, and they have very, very high chances of developing schizophrenia. So
Okay.
social network, having a social network, connecting with people is also very, very important.
Yes.
Re-establishing your social network is also important. Loners have high chances of developing.
Great. Great. I think God has a plan when He put us in families so that we
Yeah,
have that connection. Yeah. And keeping
true.
in touch with family and our extended family is very important.
So
Yeah.
the current scenario is everybody is so disconnected because of the heavy workload and the lifestyle we are living. So I have
Yeah.
seen more incidences of mental illnesses of late because of that. There's no
Yes.
connection now. People don't have time. We don't know our next door neighbors nowadays.
True. Very true. Yeah. Another question is she's a special educator, special education teacher. She would like to ask info about prodrome symptoms and how to raise, no, and about raising awareness of dangers of excess dopamine via devices used by students.
Prodrome symptoms, I think I already mentioned. No?
Yeah, you did mention.
Anxiety, unnecessary anxiety, not knowing and feeling anxious, sudden isolated behavior, withdrawing from everyone, some cognitive decline, so academic deterioration, professional deterioration, suddenly leaves the job, sits at home, not able to cope with the job, suddenly starts taking. Someone asked about even drugs, no? One
Mm-hmm.
question was on. So a
Yes,
lot of our
addictions.
schizophrenic, addictions, a lot of our patients with schizophrenia take to alcohol, take to drugs also, take to recreational drugs. Some of them even abuse our drugs in excess dose. I'll take more so that I can sleep. I'll take more of your meds. So they abuse even our psychiatric drugs, and they take alcohol and they take cannabis and other drugs because that calms them down. That gives them that same, that also does the same thing, the increases the serotonin, and they start feeling better mentally. So they
Mm-hmm.
use all this. Now the prodromes I've already covered. Now the second topic, second question is about raising awareness of dangers of excess dopamine
Dopamine
via
via devices used by students.
Yeah, so excessive dopamine is nowadays mobile addiction is something I see very much in. I'm seeing mobile addiction in school-going children to a severe extent. And recently, I think there was even a case who the girl killed herself because the mother snatched away the mobile. So that much of dependency on mobile. So these are the dangers. Yeah, it causes a lot of hyperactivity. Children with mobile addiction have got hearing problems, sensory problems. They don't socialize. So they
Right.
just don't socialize with their own family. They don't socialize. They don't go for. They don't have friends. They just live digital world. They live in their. I had one child who came to me. She had made her own world. She lived in a digital world where she would play with aliens. She would interact with those figures she made on her laptop. And nowadays we have to give them the mobile because most of their schooling is on mobile after the COVID.
Mm.
After the
Yes.
COVID, we had to buy mobiles for our young children, where this was not the need, but in COVID, it turned to be a necessity because online teaching, coaching was going on. And that made them dependent on the mobile. So, and
Mm.
then they started, once the mobile comes in the hand, we don't know what the child is watching there. So I tell all parents, please supervise the screen time and the quality, what the child is watching. Remove all the unnecessary apps, block all those apps. So yeah, that excess dopamine causes hyperactivity in children. Academic, they can't study. The mind is multitasking at one time. There's racing of thoughts. They can't concentrate. They just want to be, they say no, nowadays Reel. It's a time of reels. People don't even listen to 2 minutes. They want 30 seconds ka reels, 5 seconds, 10 seconds. The current generation is that quick. So they
Hmm.
become very restless, impatient. So those are the
Correct.
days. And they don't socialize. They remain in their locked in their rooms full day with the laptop and the mobile.
Hmm. 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 Hmm.
Social deterioration. They have no connect even with their parents.
Correct. Yeah.
May I just ask something,
Yes,
Yes.
yes,
friends?
yes. Go ahead. It's yeah.
Thank you so much. This has been very, very informative for me, and I'm sure I would be doing my own research now about the prodrome symptoms and uh, also about dopamine. I mean, of course, we do it as teachers, and everything that you said about the effect, the impact of the mobile devices and attention spans, all of that is all in a day's work for me. I just wanted to ask you, like, uh, say things like uh, introducing more of art or mindfulness activities in a child's daily timetable. Is that something that would kind of go a long way in helping students to find and regulate their own, levels of attention or uh,
Yes.
neediness in some way or the other?
Yeah. So we do cognitive behavior therapy. So how to handle the thoughts, negative thoughts, the erasing of thoughts, the overthinking. For that, there is a special therapy which psychiatrists and counselors do. It is called as cognitive behavior therapy. Similarly, mindfulness therapy helps. Yoga is there, meditation is there. We teach the children relaxation exercises. So all this goes a long way. Yeah, all that helps. And in fact, they have now shown that by psychotherapy, we only don't to give just medication. What there is actually by they say we are what we think. So if we feed our brain positivity, there are actually dopamine going, actually changes in the brain chemicals.
Yes.
So
Yes.
counseling helps it's not just ventilation. It's the techniques the counselor gives you, the techniques which you put, the positive thoughts. What we feed the brain, we become that. So if we feed our brain positivity, the body becomes positive. Mind body is one network. But we
Yes.
feed it negativity, the body also gets negative. So yeah, what we feed the child is important. So
Hmm.
positive thoughts, mindfulness therapy, teaching them yoga, teaching them our basic. If you go back to our scriptures, it all mentions all these techniques. Our nowadays parents are all working; they don't get enough time with the child. But I remember my grandparents teaching me all this when I was a kid in a joint family. Now the concept of nuclear family, children don't have anyone to talk to in the house, and
Hmm.
it's only they are playing games on the mobile with their friends who's sitting far away. That's what they are doing all day after school. And
Yeah.
so there's no physical connect, no physical connect with either mother, both parents working, grandparents not available. Otherwise, this was very important. This connect, physical connect with family members goes a long way. We learn so much from that. We learn empathizing, we learn our emotional skills, we learn how to react. And our youngsters don't know that because they have, from childhood we have given them, we are also the culprits, we have given them the mobile from day one, so he doesn't disturb us, we give it.
Hmm.
Child
Very
is
true.
not eating, mother is feeding and giving the mobile. Acha, you see this and you eat. At least she can do it. And half the time I see the parents themselves are full time on the mobile. So how do you regulate the child? The mother is only on the mobile. On the bikes now, if you see on traffic signals, people are on the mobile. While crossing the road, they are on the mobile. That much addiction is going on the mobile.
Right. Right. Right.
And
Thank
do
you.
you think, like, sorry,
Yeah.
just one last thought, like encouraging artistic and creativity
Yes,
in
yes, yeah. That's what I
classrooms.
spoke when I said about occupational therapy. So tapping
Yes. Okay.
the extracurricular talent in the child. Nowadays, the whole focus is only on academics. Only
Right.
on
Right.
we don't tap the extra. Some child may be a good singer, some may be good at cricket, some may be good at painting, but nobody encourages because the parents feel, oh, for livelihood, he has to be a doctor, he has to be an engineer, he has to be a chartered accountant, he has to perform. It's not only for the child, for themselves also to have a status in society. So we live our life through our children.
Right.
My son is a doctor, my son is an engineer. So competition. And this excess demand on the child also causes problem. excess expectations from the parents, from teachers to perform. All children don't have the same IQ. So, but
Yeah.
there are so many, like you saw that movie, Tare Zameen Par. If the person is not good in academics, he tapped another skill, and that boy was so good in another skill. But
Yeah.
not so much time in a class. We have 60 students, one teacher. How will the teacher attend to so many 60 students and tap the extracurricular skills? It's very tough.
True. 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 Okay. So I'll just need to go to the next question. Yeah, if you don't mind. Yeah. Yeah. So we'll just go quickly to another question is, if a patient is uncooperative and doesn't want to meet anybody or talk with anyone, not even with friends and family, how to deal with them so that they can be accompanied to visit the doctor. And related to that is another thing. A 15-year-old daughter, the past 9 months, she's not talking to us, not coming from outside. I mean, well, not coming with us when we go out, speaking to herself, not coming to the counselor, hiding her face, not looking at her. How can we compel her to come to the counselor? What should we do? So this is kind of related, like, no, the patient is not cooperative, basically. How can you help?
I think Chelsea has asked this question. I'll
Yes,
take that
same question.
also.
Yeah, it's the same.
Patient,
I mean, it's related. So
both are related
yeah,
questions. Yeah,
yeah,
but
yeah.
that is a case. He has just asked that if someone is uncooperative and doesn't want to meet, it is very tough. Yeah, it's very tough. And I've had relatives so often booking my appointments and then calling up, sorry, ma'am, patient is refusing to come. So this is a common scenario with mental health illness because people are scared. They don't see when you can talk your physical problems with anyone, but you don't want to expose your mental problem to anyone. You
Yeah.
consider it as a sign of weakness. Or how can I tell that I'm feeling sad? How will people view me? But mental health illness is not a weakness, it's a priority. And
Yes.
for the family, I know it is very tough and forcibly you cannot. So very often I do home visits for these people. I have to do home visits, till because it's also trust issues, and it's also they will not trust anyone. So, and they feel it's a sign of weakness to go to a counselor. It's not only youngsters, it's also elders. All of us feel, how can I have a mental problem? I'm such a strong person. I've dealt with much more in the past. So that reluctance is more so because you don't want to accept it. You think it's a weakness to be mentally ill. We prioritize mental health or physical health, but we don't prioritize mental health. So in this case, a home visit would be required, and home visit, and then someone or a close friend of, very often our teenagers have good close friends, so you can involve that friend to whom that child is listening. Sometimes they are close not to parents but to some other relative in the family, a paternal uncle or a aunt with whom the child bonds well. You can bring that relative and try to coax. If that is also not possible, then a home visit is required for an uncooperative, because it will go bad if you don't treat it.
Thank you so much. That will be helpful. Another question is, my younger daughter is 8
Sorry
years.
to interrupt, but this Manoj has asked also, she
Yes,
takes
that's what I'm asking. I'll
soft
just read
toys.
it out.
Yeah, I have it here. My
Yeah.
younger daughter is 8-year-old. When she's alone, she sometimes dance, act, and smile like she's rehearsing. Also, she takes soft toys and talk to her. Is this normal? This is also emotional isolation, isn't it? Because they don't have anyone. Children talk to toys, play with toys. So I think spending more quality time, bonding with the child here. She may be a normal child for all you know. It's just that we have not sat and been there with her. So I don't know. It's just a general thing. I'll have to see the child fully, understand other aspects also of. I need more history on that. But sometimes we parents don't have time. We are so caught up in our own we also have to multitask. So we can't give quality, and our timings and the child timings don't match. Like a lot of fathers say, by the time I come home, my child is asleep, and in the morning, by the time I get up, child is off to school. So that also is a problem nowadays. So I think I need more history on this case. A personal opinion would be needed. For all you know, she may just be normal. She's a normal child, just needs someone to
Went
interact
out.
with, vent
Yeah,
out.
went out. Yeah.
Yeah, that is more important.
True, true. Okay, what are the first signs someone might be slipping into psychosis? If someone doesn't have a support system, what's the first step they can take to get help?
Yes, that's a good question. So we have in our the first sign someone might be slipping into psychosis, we already discussed. They remain withdrawn, they talk to themselves, they laugh or cry without reason, they mutter to self, they talk to imaginary figures, they are scared, very anxious, they won't trust you, and they don't take care of themselves, won't bath for many years, won't take care of their food, they will not eat, not cook, the house is very shabby, dirty. So these all are the signs, and they will stop attending work, they may not come to office. So one of your friends, you're seeing all this, you have to understand that there is something wrong and go and approach, that they need help mentally there. And if they don't have a support system, like nowadays we have a lot of students who come and work here and do online jobs, plus they are studying as well. So there's no support system. Yeah, you have to, as if you're a friend, you can just take them to a counselor or get a home visit done, or or take them to the psychiatrist and help them in that way. If they
Yeah.
are not willing to come, you take the doctor to the house. If the patient is not willing to come to the hospital, the other option is doing a home visit.
Yeah. So we do home visits also from Raahat. So that's another thing that we do. Okay. I think there are two more questions. One is, what are the different? I think you already mentioned different types of schizophrenia. Uh, what is the difference in schizophrenia and schizoid personality? Is the symptoms the same and the treatment safe? Can support group therapy help?
Yeah, schizoid personality is different from schizophrenia. Schizoid personality, if the person, see, we can just have few personality traits. All of us have. We all have certain personality traits which make us different from others, isn't it? We have an individual trait. So some of us are like to be alone. Not necessarily every introvert is a schizoid personality. But when there are other accompanying traits, like if someone has a schizoid personality, doesn't, just stays inside, doesn't talk to anyone. But in schizophrenia, you will see the other symptoms, like they'll mutter to self, they will talk irrelevant, they'll have hallucinations, they'll have delusions. They will a schizoid personality won't have all that. He would just have be introvert, not
Withdrawn.
talk to anyone, withdrawn, living in his own zone, in his own space, happy in his own space. But otherwise, well accomplished, so means occupationally and in his personal life, you will
Function.
not see any deterioration. He'll be functioning well, but a
Yeah.
schizophrenic cannot. So that is the difference. Is the symptoms and treatment the same? No, the symptoms and treatment is different. A schizoid personality treatment is different. Schizophrenia, yeah, support group therapy will help for a person with schizoid disorder. It will help.
Right.
May not need medication. I think support group therapy is important for a schizoid personality. A schizophrenic would need medication along with support therapy, both.
Right. Can someone do if they feel isolated and worry they might be showing early symptoms? Suppose they're feeling isolated. I think that's what it
And
means.
worry. I think we covered
Yeah, we
this, no?
covered that. Yeah.
Isn't
Yeah.
it? We covered this, no? Yeah, there could be
Yes.
early
Yes.
of schizophrenia, yeah. Or prodrome of depression also. You have to take them to the doctor and
Yeah.
find
It
out.
has to be diagnosed
It can be
through
just anxiety, it can be depression, or it can be schizophrenia. That's for the professional to decide.
this side. Yeah. Like ma'am already mentioned, there is a DSM criteria and the ICD-11 criterias which the professional uses. Okay, the last question is, till what age is it normal for children to have imaginary playmates, that is talk to self? That is one question. I think you can answer that first, and then the same person has asked another question. Is there any
Imaginary thing nowadays, I think the age has gone up because with so much of mobile
social
and
media?
games and everything, yeah, social isolation is something. Children don't bond that much with parents. They just, like, someone did ask that question. No, my 15-year-old doesn't want to come out with me because they want to live in their own zone. They are happy. They are happy with their mobile. They don't want to interact. It's an effort to talk to relatives for children nowadays. Oh, I have to socialize. Oh, I have to go for this function. Huh, but if a friend calls for a party, they will go. So they want their own age group. So imaginary playmates, I have seen people now till late age also have this. because the emotional isolation is so much nowadays. I remember there was a day when I would just pick up a call and talk to a friend. Nowadays, I have to first ask my friend, hello, do you have time? Are you free? Can we chat?
Correct.
We just WhatsApp. There is no personal message. We just WhatsApp on occasions also. So
Correct.
imaginary play, this has gone on the high. This is really, I've seen lots of people who do this. And there are so many people who just talk to themselves because don't have anyone to talk to. I've seen such cases also. They don't have any disorder, but because the emotional isolation is so high, this thing happens.
Yeah, this is the last question. You have a patient waiting, Dr. Nishtha, so
Yeah,
I
I
won't
have
keep you
a,
longer. Yeah, so if patients have no insight and the family is unable to aid in development of insight, can medications be given without permission? Is it ethical?
Yeah, this is one controversy we psychiatrists have. It's called cohort therapy, where covert medicines are given. That means without the patient's knowledge, you're mixing the medicine in the food and giving. So there are two schools of thought in psychiatrist also. Some in our psychiatry also, some psychiatrists believe that we can do it because we are doing it in the interest of the patient. Right. And there is
Beneficial.
another school of, my colleagues who we have a discussion when we meet in conferences. They feel, no, how can you give someone mix in food when that person later on comes to know that you were mixing? So there are two schools of thought. Of course, in my personal advice, I give my patients because I'm doing it with the interest. If the family is taking me into confidence, yeah, we do give because we are doing it for their mental health. And the patient, when the medicines are given, recovers and then himself takes the medicine. So I've had many patients wherein I have mixed the medicine in the food and given, or even at times my long acting injections, I have told them it's a takat ki gol injection hai, aap le lo. And the patients take it, but it's a long acting antipsychotic that I'm giving them. Because now I know if I give a long acting antipsychotic for 1 month, even if he doesn't take any tablet, he will be fine. So long acting antipsychotic drugs also are available. So they are giving intramuscular, like you take any of your other injections. And then for 1 month, even if the patient does not take medication, he'll be fine.
Yes.
So
Yes.
ethics wise, there are two schools of thought.
Right. Yeah, I think these are the questions, and I don't think I have any more. I hope I've not missed anything. But in case we have not answered, please do get in touch with us. I think most of y'all would have been added to the group already. If not, please get in touch with us, and we will, put you on the group. We would love to keep connected with you. So just to tell you a brief that Raahat, and we've also posted a feedback form on the group, on the chat box. If you can please take a minute or two to just put your feedbacks, give us some inputs on how we can improve further awareness sessions. It will be really helpful. Okay, so we can connect. Anybody has more questions which were not answered, please connect with us on personal. Okay. I think that's it for today. We want to just thank you all and thank you, Dr. Nishtha, for taking this time with answering all the questions. I think it was very helpful. Thank you all.
Vinita, for having me on the show. And thanks everyone for registering for this program.
Yes, yes. Thank you all and see you. We will keep in touch with you all.
Thank you